Okay. Regular sort of council meeting. And Judy, if you could call the roll, please.
Yes, indeed. Hausch.
I am here.
McQueen. Here. Stokes.
Here.
Krieger.
Present.
Thank you. Curlis.
Here.
Also present are Village Manager Josue Salmarone, Village Solicitor Chris Connard, Colleen Harris, Finance Director, and Johnny Burns, Director of Public Works.
All right, thank you, Judy. And again, welcome everyone. This is, I think, our first official virtual council meeting. And in a minute, I'm going to have Josue talk a little bit about some of the protocol for how community members can participate. I do want to highlight that the village is actively practicing physical distancing and the governor's directives. So I, along with Sean Devine, our awesome cameraman, and Philip O'Rourke, who is hosting the meeting, are the only people in this room. All the other participants are coming in through Zoom virtually. And I just want to emphasize that, again, we want to make sure that everybody is doing all that we can to help save lives. So with that, Josue, if you could talk a little bit about tonight's protocol.
Thank you, Brian. My comments are around access and viewing and public participation. So we have several platforms which you can join us to view the video and listen to the council business conversation and be part of the conversation. So there's two ways that you can access the video feed. There's channel 5, which if you're a cable subscriber, you just tune to channel 5 and you'll be able to catch that video feed. We're also on our YouTube channel, which is Community Access Yellow Springs. So go to that YouTube channel or go to YouTube, search and put in the search bar Community Access Yellow Springs, and it'll take you to our channel. And so you can catch the conversation there. We also have several ways for you to participate. One of those methods is through the YouTube. There's a chat box next to the YouTube video, and you can participate in that chat box. It's open, so you can ask questions or you can make commentary, and that's available to us on the admin team and also to other viewers. When we're queuing up for questions during the public comment period, we will look at that chat box, particularly Philip O'Rourke will look at that chat box and take your questions and comments from that chat box. There are two other methods that you can engage with us tonight. You can call in, so you can call in and ask your question. That phone number is 937-767-3402. We're staffing that line, so someone's there to answer your call. If for whatever reason there's a queue or there's a long line, you will be prompted to leave a recording. That recording gets put in an email, and someone will transcribe that and get that question to us. You could also email your questions, and there's two email addresses. You can email them to the clerk, clerk@yso.com, or Philip O'Rourke, and that is POROURKE@yso.com. Also, if you're joining us through Zoom, you're able to participate in the conversations through both the chat box in Zoom or raise your hand on your Zoom platform to ask a question. Raising your hand is a very easy process. You click on your screen and you hit raise hand. So that's another way for you to participate. Brian, passing it on back to you. Thank you. Brian, we can't hear you.
His mic is muted.
All right, yeah. Philip got that fixed, so sorry, I was muted for a second, everyone. But I did want to thank the community leadership team, which represents over 30 organizations and individuals that have come together to help support all of our community needs. I also want to thank all of our community members who are on the front lines, making sure that we have essential services in terms of food and medicine and so forth. And a special thanks to the village team, Josue, Philip, Sean, everybody else that is making sure that the water's on, the electric's running, all the things that we need to remain a thriving and healthy community. It's just been amazing how everybody has come forward on that. The other thing I want to emphasize, again, is right after this council meeting, we will exit and we'll go into the virtual town hall, where we'll have some updates from Greene County Public Health, Chief Carlson, Chief Altman. So stay tuned for that as well. And with that, we have a consent agenda with 3 items. These are our minutes from March 2nd, March 12th, and March 16th. And I'd love to get a motion to approve that consent agenda. Marianne?
So move.
Okay. So I got a motion from Laura, a second from Marianne. All those in favor? Actually, we're going to roll call. So Judy, do you want to do the roll call for the consent agenda?
Yeah, I'll do roll calls for the resolutions as well, just so I'm sure of everyone's response. So Krieger,
Yes.
Stokes,
Yes.
McQueen,
Yes.
Curlis,
Yes.
Hausch.
Yes.
Thank you.
Thank you. Okay, next up, review of the agenda. Any items that we need to add, remove, or modify before we move forward? Okay. If not, then Marianne, if you could review the petitions and communications, please.
Certainly. Yes, we had several letters from citizens concerned about people coming into the village and requesting that we do make efforts to stop that, which has happened. So those were from Aaron Rogers, Tanya Kimmett, Kate Hamilton, and also Katie Rose Wright. Thank the village for doing that. We had communication from the Regional Income Tax Authority granting an extension for filing the village income tax to July 15th. And Greene County submitted an annual report, which I really suggest people look through the packet and read. I found it to be very interesting. They also submitted a poster on things to do during this time period, and information that Greene County, as most people probably have heard, has had 1 death from the COVID-19 and I think 4 total cases so far. Brian, you submitted 2 documents, one with Josue, discussing how the virtual council meetings and town hall meetings would work and how people can be involved.
Oh,
Then Karen Wintro
okay.
submitted a letter discussing with very great sadness that the street fair is being canceled for June, and discussed in length why that was the case and why that was the right thing to do. Lastly, Lisa Krieger submitted a list of contacts and resource information, and I'd like her to address that.
Hi, I'm glad to do it. This is Lisa Krieger. Hi, everybody. I want to echo President Tausch's acknowledgement of the tremendous collaboration that's been going on as we face this really unprecedented time. And, I began the document by saying, the expression "it takes a village" is really more appropriate than ever. And in particularly, I want to talk about the way the village team, the schools, the township, the community foundation, the Chamber of Commerce, the Senior Center, the Credit Union, Antioch College, WISO, the news, and many others have been coming together to provide critical services. And I think in a spirit of trying to lift our spirits too as we shelter in place. One of the things that I was concerned about, though, is that although there's been information in the paper and on websites, I thought it would be helpful to put a few of these key projects and sources of communication together in one document for the packet. And then Marianne McQueen has suggested that this might be appropriate to also post on our website. I would see it as a living document that could be kept up to date, and I'm glad to do that, as I, like many others on this meeting, are very actively involved in these initiatives. So I also want to point out that this is not an exhaustive list. In fact, all of these are in addition to the ongoing services of the village and township. So what the police are doing, what the fire team are doing, what Johnny Burns and his team are doing, all of that isn't listed out on this document. So here's just those that I summarized. First of all, on Monday, Wednesday, and Friday at 7 o'clock, there are town halls, and these can be viewed on public access or Channel 5 or YouTube stream or Facebook stream. Many people in the community have said that they want to volunteer and help. And so the Yellow Springs Community Foundation is graciously working as a central hub for volunteer sign up or to communicate a need. And they can be reached via their website, YSCF, www.yscf@yscf.org, or at 767-2655. Thank you to the Yellow Springs Federal Credit Union, who very quickly created a new emergency assistance fund. And to find out more about that, contact the credit union. Both our wonderful Florence Randolph and Melissa Hestons from the Community Foundation are focusing on food security, delivery, and restaurants. And that includes the continuation of school breakfast, as well as seniors, options from restaurants. So obviously the schools are all hubbed into this, and the senior center. Mental health resources are available through Florence, through the Yellow Springs Community Foundation, and through the coronavirus.ohio.gov website that has a lot of great information about coping with anxiety. There is also a wonderful neighborhood block project going on that sprung from the block party list that's intended to help neighbors check in on one another and know if anyone has any needs. You should be hearing from your neighborhood block project key person, or if you haven't heard in the next couple of days, you could reach out to the Community Foundation. As some of you may know, there's limitations on youth services and childcare. And if you're looking for a child care center approved for pandemic childcare, you would also find that on the ohio.gov CDC site. And finally, for any assistance with legal advice, estate planning, healthcare power of attorney, evictions, or any other legal matters, please also contact the Community Foundation. They are acting as a hub and sorting out these requests to the right people. Also on this document are some key information sources. WISO is broadcasting public service announcements. Governor DeWine holds a press conference every day at 2 o'clock, and that's you can hear that via local PBS TV stations, on the radio, on WISO, and on the Facebook Ohio channel. The news is a fabulous source of continuously updated information. I've already mentioned the Community Foundation's website, the Yellow Springs Bulletin Board on Facebook, the Greene County Public Ohio State Health Department websites are a really good source of accurate information. There's a lot of inaccurate information out there, so I would urge you to stick with the Public Health Department's website or the CDC, the Center for Disease Control. These are accurate sources of information that you can trust. Thank you.
Okay, anything else, Marianne?
Nope, that's it.
Okay, thank you so much. Thank you, Lisa. And we're now going to move into legislation. And first we have the second reading of ordinance 2020-03. Judy, could you read that in by title only, please? Okay, actually, I can do that myself. This is ordinance 2020-03, repealing section 104601, connection fees of the codified ordinances of the Village of Yellow Springs, Ohio, and enacting new section 104601, connection fees. Can I get a motion, please?
I move.
Okay, can I get a
Second.
second? Okay.
Second.
So, we got a second from Lisa and a motion from Marianne. And Judy, have you rejoined us?
I have. I got completely knocked off the internet there, so.
Okay, great. So I've already read it in full, or read in the title. I do want to highlight then that because this is the second reading, we are going to open the public hearing. And Judy, if you want to begin by explaining this housekeeping legislation.
Right, that's exactly what it is. It just clears up some of the verbiage to make things clearer, and it conflates some of the tables in the documents to make them clearer. And go through it, you can see what's been crossed out and what it has been replaced with, and it just makes for a much simpler read. And that's all there is to it. No change to rates at all.
All right. Thank you so much, Judy. So with that, I'll first of all ask council members for any questions or comments. Laura, anything from you?
No. The only thing I'm wondering about is, and this is for future, if other communities are doing it the way we're doing it, because I mean, we've simplified it and that can be good, but there's no distinction between residential and commercial, but maybe that's okay because there's a distinction with the size of the lines and the rates.
Okay, thanks.
The connection fees. Thank you.
All right, thanks, Laura. Kevin, any questions or comments?
No, like Judy said, it's pretty straightforward, just cleaning up. No, there was nothing, I saw there was article in there.
Okay, Lisa Krieger?
No, thank you.
Okay, and Marianne McQueen, nothing? All right, and I also think this is pretty straightforward. I think Laura's comment could be something to look at when we're back to live meetings. So with that, do we have any questions or comments from citizens? I don't think I see any.
Brian, if
Yes.
I may add on the,
Yes.
Laura Curtis raised the issue about making no distinction between residential and commercial.
Mhm.
And some of that, because the size of a traditional house line, it's very limited. No one's going to go above an inch. I mean, someone may go higher, but there's no practical purpose. And if they want to go higher, they'll pay for it. But we didn't see the need to make a distinction just because the residential service lines can be limited by size. And Johnny Burns has gone in great detail about how a home could, the size of the homes and how they're limited.
Okay. Johnny, did you want to add anything to that? Okay. All right, you're unmuted.
I just say that it's straightforward, and we don't typically have anything over a 1 inch for residential. I don't even know that we have a commercial rate for water. So there's no sense in having two different classifications at this time.
Okay. All right, thank you, Johnny. So I don't believe I see any other questions or comments. With
Well,
that.
Brian,
Okay.
the point that Johnny just made, he says he doesn't know if we have a different rate for commercial water usage. Are we sure we don't, or is that something we want to? I mean, just to have a definite, either it's the same or it's different.
We got one rate for water.
You know,
Okay. Anything else? Okay, then I'm going to close the public hearing. And Judy, if you could call the roll, please.
Yes. McQueen,
Yes.
Stokes,
yes.
Curlis,
Yes.
Krieger,
Yes.
Yes.
Hausch.
Okay. All right, next up we have Resolution 2020-12. And Judy, if you could also just read that in by title only, please.
All right, this is Resolution 2020-12, approving purchase of a replacement pump for the wastewater reclamation facility.
Okay. Can I get a motion, please?
I'll move.
Okay, I think Marianne beat out Laura by a millisecond.
I'll
So-
second.
All right, thanks, Laura. And Josue, I believe you're gonna talk briefly about this, or would you like Johnny to?
Yes, and Johnny's here to join me for that. As you know, we have 3 pumps that run the lift station. The lift station moves a little over 70% of the sanitary line volume, and we rely on these 3 pumps to push the sanitary waste from the lift station over to our wastewater treatment facility. This pump that we're looking to replace is near the end of its life. Actually, it's exceeded its life. It's still hanging on there, but we don't want to wait until it absolutely breaks down to have this contract in place to replace that. It is an instrumental or critical part of our infrastructure. Without that pump, we would not be able to handle the 6 million gallons that ran through our sanitary lines a week ago. So it's a critical component of our infrastructure, and we're asking for council for their approval to move on spending the $55,000 to replace this pump. Johnny?
So can you hear me now? I was. Yeah. Here we go. So this is actually the second of 250 horsepower pumps that we have. We actually had to turn it on 3 weeks ago on that 6 million gallons. And there is a non-repairable seal on that pump. So as much as it helps pump, it also throws out sewage in the lift station area. This one would be replaced. And then the one that we actually have as number 2, the other 50 horsepower would actually be the backup pump. This would be used, the new one would be used to back up the 20 horsepower that runs 24/7.
Okay, thank you, Johnny. Do we have any questions or comments? Marianne?
I was sitting here figuring how many gallons of sewage per person per day. Comes out to about 200 gallons, I guess. Yeah, I mean, definitely, we need to do this. But that 6 million gallons for that week, was that high, and was that because of rain event?
That was for that 2.5 to 3 inches of rain we got that one day, or that one night.
What would the normal, a non-rain event normal be?
I think the averages is like 500,000. Is that right, Kurt? I don't have the numbers in front of me, but
We've
Wow.
done some data analytics on looking at our daily flows, and on a dry day, we're looking at somewhere between 250 and 300,000
Okay, yeah, I
gallons per
remember.
day. So to take on 6 million gallons on a rainy day, that's all infiltration and inflow.
Okay,
Thank you.
all right. Kevin?
It's a geeky question. It's just Johnny said that the new pump will become primary and the older one will become secondary. You have to move the older one, or is it just a matter of flipping switches? Okay.
it's a matter of flipping valves. So the horsepower runs 24/7. The 50 horsepower is the backup for that one that runs half the day. And then the one that we're not replacing will become the backup because during that 6 million gallons, we had two 50 horsepower motors and a 20 horsepower running at the same time.
Yeah.
Keep up with the flow.
Okay. All right, great. Thank you.
Okay, Lisa? All right, and Laura?
I do have something, sorry, it
Oh,
just took me
please.
a second to get off mute. I just,
Right.
as I recall, this was budgeted, right?
Mhm.
This was an expected expense for this year.
This one's actually
Right.
budgeted for this year, and we have the other one budgeted for next year.
So I think that's important for everyone to know that even though this is coming, it's just to allow us to spend the money that was already budgeted.
Correct. This is part of our capital budgeting process. We look at what aging infrastructure we have, and we're trying to get ahead of replacing that key infrastructure.
Okay.
I think that is a good point, Lisa. I appreciate you bringing that up because I wondered as well, but I thought it was because I know I'd heard about pump failing in the past, but I think it's always good to highlight those kind of things.
And I do think, Lisa, that I misspoke. The other 50 horsepower pump is due in 22. So we'll try to span it out 2 more years to replace the other 50 horsepower.
Okay, thanks for that clarification.
We don't like surprises, and we know you don't like surprises either. So we're planning on these.
Laura, any questions or comments?
No, just thank you for your planning and looking ahead.
And I did see a question come in from Megan Bachman asking if this would help to decrease the odor that sometimes comes from the facility on Route 68. Donnie?
It will not help decrease that odor. It's just going to help pump it faster down the line.
Okay. Any other questions or comments? Okay, I don't see any. So Judy, if you could call the roll, please.
Indeed. Stokes,
Yes.
Krieger,
Yes,
Perlis,
Yes,
McQueen,
Yes.
Hausch.
Yes.
Thank you.
Okay. And our last piece of legislation is Resolution 2020-13. Judy, we can also do that by title only.
Okay, this is granting revolving loan fund monies to the Yellow Springs Development Corporation.
Okay, can I get a motion?
I move.
I move.
All right, I think we got Marianne as a move and Lisa as a second. Lisa, I think maybe this is one for you to kick off.
Sure, I'm glad to do that. As you know, we've been working for quite some time in anticipation of being able to make this transfer of funds. You may recall that in January, the Village Council designated the Yellow Springs Development Corporation as the economic agent for the Village of Yellow Springs. We've been holding $30,000 in money for quite some time that was actually left from a grant for the purpose of a revolving loan fund. And now that the Development Corporation is fully formed and designated as the economic agent, this resolution is to make that transfer of funds. There is an economic development line in the village. That is where Colleen will transfer the money from. And the other point in the resolution is that the Yellow Springs Development Corporation has adopted an open meeting policy and is in conformance with the sunshine laws. And so don't be concerned that this money is going into a black hole. It's just going to be able to go to work as part of the Development Corporation. Thank you.
All right, thanks, Lisa. So there was one thing that I noticed in the resolution that it's in the title, but I suggest that we add it in the first whereas and in section 1, which is that these monies are dedicated for reestablishing the revolving loan fund to support local businesses. Again, these are funds that we appropriated last year because we wanted to move this forward. We finally figured out a mechanism. And part of why we're acting on it tonight is we feel that this could be one more thing that can help support some of the impact that local businesses are feeling with COVID-19. So I wrote it out as specifically the purpose of reestablishing the Yellow Springs revolving loan fund to support local businesses. So other questions or comments?
Brian,
Kevin? Yeah, Josue, go ahead.
Brian, would you consider another change? Just trying to make keep all of our documents straight here. On our budget, and I'm sorry we couldn't get this to Judy and Lisa on time. On our initial budget request, we had the revolving loan fund at $35,000, and we anticipate coming back to council for the $35,000 as a supplemental to have the spending authorization. It's a separate procedure. So just we'll wanna clarify that if we'll be leaving it at 30,000 or at the 35,000.
Yeah, I think we should go with the amount that was set aside, because that 35,000 was the amount that had been remaining from when we had the revolving loan fund before. So that would be a good update to make as well. Okay. Thanks, Josue. Kevin, any questions or comments? Okay, Laura?
Do we have a motion to amend to from 30 to 35,000?
I think we'll do that after any other comments.
No, I think it's a good thing to move it to the Development Corporation.
Okay, great. Marion?
Yeah, Brian, where did you want to add that purpose statement?
I think we should add it in the first whereas at the end and also in section 1.
Okay.
Because.
So can you just go through that, Brian?
So yeah, actually I'll pull it up real quick.
Don't get on the internet. You're not going to get again.
So, so the first one says, whereas the Village of Yellow Springs has funds reserved for economic development held in the Economic Development Fund line, specifically appropriating $35,000 to reestablish the Yellow Springs revolving loan fund to support local businesses. And then in section 1, the Village of Yellow Springs hereby grants the sum of $35,000 to the YSDC, and again, for the purpose of reestablishing the Yellow Springs revolving loan fund to support local businesses. So that also captures the 35,000 change as well.
Okay.
Okay. Laura, anything else? Okay. Lisa, any other questions or comments? Okay. Marion's good. Okay, so I don't think I see any other questions or comments. Oh, Philip, we got something? Okay. Yeah, Megan, do you want to go ahead and just unmute and ask your question?
Yeah, thank you. Kind of hard to write out. But at some point, I don't know if it was the Economic Sustainability Commission, but somebody came up with some guidelines or rubric for how this money would be used. Is that something that goes with the money, or is the YSDC coming up with their own criteria for who gets these loans?
Lisa,
a little of both, Megan. Yeah, a little of both. The rubric that the Economic Sustainability Commission developed was following the village values and the impact to village values that any applicant would have. The YSDC has been working on documenting their own value statement, which is very much aligned with the village values, but we've decided that it's worth just taking a really good look at the way those sort of rubric is devised. So it won't be taken in part and parcel, but it's very similar, and now that's something that can be taken up by the YFDC. Good question, thank you.
All right, thanks, Lisa. Any other questions or comments before we call the roll? Okay, if not, Judy, if you could do the roll call, please.
Yes, McQueen,
Yes.
Curlis,
Yes.
Krieger,
Yes,
Stokes,
Yes.
Hausch.
Yes.
Thank you.
All right, thanks,
as
everyone.
amended, right? Yeah, as amended.
As amended, yes.
Esmond.
Okay, thanks for that clarification. Okay, so we do not have any old business. We've got 2 new business items before we wrap up this meeting. And the first one is about whether there's a need to locally declare a state of emergency. And since we do have Chris Connard on Zoom, both Chris and I participated in a webinar from that was hosted by the Ohio Municipal Attorneys Association. It was very informative around why you might do this as a municipality. Chris, do you want to kind of give a brief overview of what you heard from that meeting?
Sure. Can everybody hear me?
Yes.
Okay, good. So the threshold of the questions have to do with what I'll call disaster relief. And the first question I think any community has to ask is, will the declaration of a local emergency put a community in a better position to receive state or federal disaster funding? And the consensus throughout the state is no, it doesn't necessarily do that. By virtue of the fact that Governor DeWine declared a state of emergency, that the belief is that that makes communities local for federal funding that would be dispersed. And I believe under the Stimulus Act that was passed, I think I shared with Josue, there is some allocation that's out there that has been made to each state as part of that funding, although the state of Ohio has not yet determined how it will allocate the federal funds that it might receive. So then the second question that comes up is there anything that's particularly unique about the community that would require the need for the exercise of police powers in some way due to the nature of how the emergency is impacting a given community? In larger communities, there have been issues with essential businesses, what's an essential business, what's not, issues with people gathering. This was really a significant issue before the governor closed bars and restaurants, because if you recall, that was done on a Sunday afternoon, and the following Tuesday was St. Patty's Day, which would have led to a large number of social gatherings. And so I think many of the issues related to social distancing in clusters of 10 or less are, for the most part, not an issue for many communities. I'm on the OMAA blog. I get inundated with emails daily, as most of you are, from various sources. And there are some communities that are having some issues with it, and they are dealing with it. And one of the ways they've chosen to deal with it is through the declaration of a local emergency. But it's not an essential thing to do. But it could add some clarity for the community if one were to be issued. But that is a policy decision I would put on at council, since you're uniquely aware of the situation that you've got within the village. And I'll stop talking there and mute myself.
Thank you, Chris. I'll just add, kind of highlighting what was the most important question to me, beyond just, whether our charter and the Ohio Revised Code already covers what we need, was whether this would have any impact on accessing funding. And basically what we heard on that call was that you shouldn't need a state to declare a state of emergency for that. But there was one anecdotal comment from someone who had a friend who knew a FEMA auditor in New Orleans, and that they had said something about how being able to point to a resolution might have been helpful. So that was a pretty vague kind of response. There wasn't anything conclusionary otherwise. So that's basically what we heard. And so questions and comments. Lisa, anything that you have a question or comment about?
Well, I find myself just interpreting your comments to say that there really is no reason to do this. That's my interpretation, but I don't feel completely crystal clear. So I'll be interested in others' comments. Thank you.
Okay. Marianne?
Unmute.
Unmute.
Reason to do it.
There we go. Now we can hear you.
Did you hear me?
You just,
I
now we
said-
can hear you. Yeah.
I agree with what Lisa said from the comments that both you and Chris made. And my inclination would be to not declare a state of emergency unless there was clarity that it served a purpose. And I guess, and I say that I don't want to make things exacerbate people's sense of things, I guess.
Okay. Laura?
Yes, thank you. I also was on that OMAA webinar and was interested to learn the city of Columbus did pass an ordinance declaring a state of emergency. And I asked Judy Kentner to see if she could get that for us so we could look at it. My inclination is that given the governor's declaration, that two things, it can't hurt. And I agree with you, sometimes when disaster relief funds are available, the first thing they ask you to send them is proof that you had declared an emergency or that you were under a state of emergency locally. So it would serve that purpose. And the second thing, and this kind of goes to an item down the agenda, is, you know, when governments start to take public assets away from the public, like even something that may seem as obvious or not as closing a parking lot, that you're doing it for a really important reason, and therefore connecting up in the legislation, the reason we're taking parking away from the public or doing something else that infringes on the public's normally what's their right to use. So those are two reasons I think that we ought to consider it.
Okay. Thanks, Laura. Kevin?
Yeah. I did hit the button. It just didn't work. One would think that, you know, in that we are under the umbrella of the state, as it were, that for the most part, you know, funds that would come either directly to the village from the federal government or through the state government, we'd be eligible for without any question. From a funding, the letter that I read from Chris's law firm talked a lot about police powers. Of course, the comment that Laura just made about, you know, commandeering parking lots, so to speak, that's a police power. I guess I would like for there to be some comments made from leadership, from police chief and Josue, about what people's expectations should be. I mean, I've been involved with a couple of conversations, one over the weekend and one an hour ago. Over the weekend, someone said they saw folks gathering very closely, but since they left town right after that, they didn't do anything. But there was a call made. I don't know how the call was made, but there was a call made to police this afternoon. There was a small gathering, some play some music in a driveway, and from what I understand, at most 10 people gathered, but there was a complaint made to address that. And so I just wondered if we could get some guidance about what our expectations should be. When do we feel it's appropriate to make a call to the police about a potential violation of existing orders?
Okay,
I think Brian, if I may jump in,
please.
I think there were a couple of things in your comment, Kevin. One is what is our need for, do we see a need from the leadership of the administration for an emergency order? And the second one is what powers we may have to address any gatherings. Is that correct? And the legal opinion from our village solicitor, Chris Kennard, outlines the administration's power, which is in line with the state of emergency. So currently, we have the police powers to enforce the provisions in the state of emergency, the no mass gatherings, and do other measures that we deem necessary to enforce the social distancing, enforce other provisions of the stay home order and the emergency declaration. In terms of what we're doing on the reducing gatherings, our police chief Carlson has clear directives based on the ORC, what laws he's able to enforce, and he's doing that when he deems it necessary. And I can let Brian Carlson jump in on that as necessary. But to the point is that there's two issues there. From, do we need a state of emergency? Our current charter doesn't grant us any special powers by a state of the declaration. It's not considered. So there isn't anything that my administration would now be entitled to by your declaration of the state of the emergency. However, I think it's to Laura's point, that it's a good idea to check off that box. It is a standard request for financial assistance or financial aid from the state and the federal government. This one seems pretty obvious. It's affecting the entire world. So we could probably replace our own declaration with the state or the county, since both have already done so. And Brian Carlson, I'll let you take the piece on local enforcement.
Thank you, Josue. From the police department, our primary duty is public safety. Our efforts are mainly in line with the public health department and the governor's orders regarding maintaining and limiting the influx of people from other communities into our community. And how do we do that? This virus kills people. We know the gravity of the situation. How do we balance the message between our normal, we care about you, everyone is welcome, to please stop exposing our community to this deadly virus? So it's a fine balance there. Officers are doing a fantastic job right now. The only citations that we are writing we have written are parking. We are doing a lot of parking citations now because the lots have been closed and people are using any means possible to park and be able to go into the Glen. So we are consistently monitoring that. I believe that the Village of Yellow Springs population, at my best guess, is probably within the top margins of a vulnerable society. So what we're asking from the police department is simply for everyone to help in our massive efforts to save lives. And people can do that by staying home. We're certainly not patrolling and giving orders or anything of that sort. We remind people, we take calls for service, but as more people are not following the governor's orders and the more complaints that citizens express to our team, I can only in good faith continue to try to reduce the number of people that come into the village. So we're doing that as gently as we can. I hope that answers your question, Kevin.
Well, it does. It makes a valid point in that, yeah, I think in terms of, trying to keep the bubble pristine, that's one thing. But this was, I wasn't there. Family members were there. Actually, it was in the driveway of a family. And it was 10 people gathered. I'm sure they were pretty far out. And a third of them were under 6-year-old kids. You know, I guess I was personally surprised that the event was still going on, but it was a very small gathering, and someone, and I just thought again, you know, as residents, you know, if we're going to have a distance cookout, even though we are all told to stay home, we do go out from time to time. But if we're having seems to, for the most part, comply with what the requirement. You know, should you expect a cruiser to show up or not?
Well, we're obligated to show up no matter what if we receive a call. So
Understood.
that's our job. The question is how is the interaction after we show up? And so the officers are doing very well with that. We've only had a couple of calls over the weekend where they were larger gatherings, and it all worked out fine. You know, I had the officers contact me after the calls to let me know what had transpired. So that was good. The difficulty here for us is we are in a state of emergency as peace officers, first responders, healthcare workers, firefighters, and EMTs. This is a state of emergency because we are called to the front lines in the worst possible scenarios. So I believe in that spirit, we might deserve the benefit of the doubt regarding the messaging that we're trying to put out there for people to help one another, to save lives. I'm sure you've seen some of the signs MTFR put out: stay home, save lives.
Right. Yeah.
Those things are huge, and that helps us. We would not wish this disease and disaster on anyone, and we're hoping to continue to take positive steps forward in assisting that.
Okay, thank you. Yeah, and as far as I know, everything was handled well, everything went well. So but I definitely appreciate your input. Thank you.
Okay, yes, Chris.
There. Sorry about that. So one of the things I want to add is it's come up, both you and Josue mentioned to Brian, which is what's in the charter and what's in our codified ordinances. Many larger communities, I think most do, already have codified ordinances that grant the power to declare a state of local emergency, either through typically the city manager, in this case it would be the village manager, or the mayor, and in this case the president of council for the village. One of the things that should be discussed once we're through this, whenever that is, and people have an opportunity to reflect on our experiences, that what should the village do vis-a-vis, and whether or not there should be a need to put in a provision in the codified ordinances, or even consider a charter amendment, although that's not necessary, that would give the power to declare a state of emergency under certain circumstances. And there's a myriad of examples that are out there from other communities. So I raise that for the benefit of everybody's knowledge, but I don't think now's the time to have that conversation.
Okay. Thank you, Chris. Are there any other comments on this topic?
I would second what Chris just said, because I've scoured the charter and the ordinances a couple of times. And because on the OMAA webinar, we were asked, well, under your charter, who's the conservator of the peace? You know, that was the first question they asked, and ours is not clear. Ours puts the executive and the legislative power into council, with then from thence flows executive power to the village manager. So it could be clear in our charter for sure on this topic, and so it's worthy for further discussion in the future. As far as, you know, so probably the thing about this governor's stay-at-home order that has bothered me the most is the definition of who is family. It reminds me of discussions in non-traditional families, like who is a family? So many of us, probably the majority, live in non-traditional family groups, right? And yet we cannot gather with those people if we're not related. So, and I'm even going to write to Dr. Acton and suggest that they simply make it no more than 6, 8, 10, whatever they're going to say, groups, gatherings, and that when you gather, you stay 6, 10 feet apart. And so I am bothered that we would be breaking up a group if it was under 10, because that's right now the limit. If they were properly socially distancing, sitting outside in their driveway or around a campfire, I am bothered that people can't do that. Because part of it goes back to, well, if you were a family, if you're all related, you could do that, but not if you're not, even though you consider those people your family, as we all do. We all have those social connections, which are so very important at this time. Anyway, thank you very much.
Okay, thank you. So I think at this point, this has been a productive discussion. I think some good points and some things that I think citizens care about that were raised by several council members were good to discuss. I've heard enough to think that maybe we do a little bit more homework and potentially look at a sample resolution on April 20th, our next council meeting. And then maybe we move on to our final topic so that we can wrap up the meeting and allow for the town hall. So let's talk about our final topic under new business, which is essentially about, yes, go ahead, Marion. You're mute.
Unmuted? Now
Yeah, we
I'm
can hear
okay.
you. Yeah.
Okay. I have been more convinced listening to, well, everyone else was talking about the efficacy of having such a resolution. I guess it would be a resolution. But then I was confused about whether we can do it since it's not in we don't have an ordinance saying we can do it. Can that be clarified? I mean, do we have to do some pre-thing before we do it?
No, we can pass a resolution. So that's within our purview. So we'll take a look at that next time, and then we'll keep in the parking lot looking at our ordinance or looking at our charter in the future. Okay. So the last topic is related to, we've kind of titled it as keeping public spaces open to the best of our ability. And Laura, I think I'll let you open up with this topic. I know you made a little bit of a reference already, but kind of, I know you wanted to discuss this tonight.
Well, I just want to keep it out there because, yeah, the next 2 weeks are going to be the top of the hill, hopefully, or the mountain. But if this goes on for months and months and months, at some point we're going to have an exit strategy. And I just read today my first article about what will that look like, and it'll probably involve loosening some of these restrictions and tightening them again if a vaccine is not found or herd immunity doesn't develop. So I think if we have a declaration of emergency, we can talk about what public assets need some access, and including, like, the summer, the basketball courts are closed, but if we had volunteers, and I think they're parent volunteers who could monitor, no games where they're like bumping into each other, but could a kid shoot a basket if there was one per basket or something? I mean, could we do something that is less than total closure to give people, relief safely with the distancing and so forth? So that's just something I want to continue to discuss.
Okay, yeah, and I think that's, I like the idea of keeping it out there as well, and recognizing that, like Chief Carlson said, we're trying to maintain that balance while following the governor's directives and keeping everybody safe. And I think the other piece of this is for those of us that are following Governor DeWine's press conferences. I definitely heard this. I think Josue did too today. Some signaling that people need to, behave well if we want to keep these amenities open. We already know that playgrounds, those closures were directed by the governor. So I'm definitely hearing that message out there, that a lot of it is up to us to, practice all these things like physical distancing. Josue, do you want to say anything briefly on this? I mean, it sounds like for the most part, Laura just wants to make sure that we're keeping this on our radar and thinking about that balance. Did you want to add anything?
Yes, Brian, thank you. Brian, it's not just the governor and Dr. Acton that are signaling for people to use their heads and practice basic protective measures. Counties are moving beyond that. We're actually closing parks down because people are not following the basic protective measures. I have a list of 3 parks that have already closed because folks are just not adhering to the social distancing. They're showing up in groups and just overwhelming the park system. Dr. Acton showed Google data looking at the changes in travel. Folks have stopped going to grocery stores, less travel to retail stores, and increase to parks. So I think it's important that we take all the necessary measures to reduce the density of people, to contain the spread of the virus, to help protect lives. So I'm worried that we're entertaining the notion to opening the parking lots and playgrounds. I think it's important that we do all that we can to save lives.
Okay. Yes, Chris.
I want to follow up on and kind of echo this theme that Laura's raised, which is the exercise of the police powers during a state of emergency isn't much different than when ordinary times. In other words, the police are given broad discretion, but it's clear, and this is true even without an emergency, but within an emergency, and it's reflected in the opinion on page 3, that it has to be the regulation has to be reasonably designed to accomplish what the purpose is. And in this case, it's to protect the public as a whole, because clusters of people that are too large or they're not engaging in social distancing is reasonable to do, given the declaration of stay at home. And then they can't be arbitrary, discriminatory, oppressive, or otherwise unreasonable. Those words sometimes sound broad and undefined, but they have specific legal meaning. And so it's not as if the combination of Josue or the chief can simply go out and do what they think subjectively is what needs to be done. So there are legal standards that have to be met. And if those standards weren't met, there would be a basis for a legal challenge. Now, given how slow the courts are, this would probably be addressed after the state of emergency was resolved. And we can look back in history of the country, and there's many examples that would take this into account. But I just want to assure everybody that these are thoughtful decisions that are being made that are representative of situations that are happening over and over again, not just isolated circumstances. And so there's a thoughtful process into the implementation of those police powers, and I'll stop there.
And thank you, Chris. The other thing that resonated in your memo about this was that in these crisis emergency situations, it's evolving. And I think that really underscores what I think we're talking about here. And, I've been impressed with our responsiveness and thinking about how we maintain safety. And it does sound to me like, unless there are any other critical comments, that this is something that we are going to keep on our radar. And I know that Josue and Chief Carlson will keep us updated so that we are doing what we can to still allow people to recreate safely. So anything else critical before we wrap up our council meeting?
Just to support what you said, Brian, I think all of what we've done has been discussed, and we're being as thoughtful as we can in this process. We're adhering to the spirit of the law, and the letter of the law. And we've also had the conversations with Chris about this. So we're doing all that we can in the best way that we can to ensure that we're containing this virus. Obviously, I work at the discretion of council, and council wants a different direction. Welcome that, but we want to do the best that we can. We think about how bad this pandemic can get, and we haven't peaked. We're far from it, and so what we do now matters.
All right. Thank you, Josue. Thank you, everyone. So final words, I just want to say, stay positive, stay local, stay healthy, and please be kind. So important these days. And so with that, I'd like to entertain a motion to adjourn our council meeting.
So moved.
Okay. Sounds like Laura gave us a second. And Judy, if you could do our last roll call, just to make sure everybody does indeed want to.
You bet.
Okay.
Yes.
Curlis,
Yes.
Krieger,
Yes.
McQueen. McQueen. Ouch.
Yes. And a thumbs up looks like a good yes to me.
All right.
So thank you, everyone. Our council meeting is adjourned. Our next meeting will be April 20th, and it will be the same format. Please give us any feedback. We want to be as responsive as possible to maintain our democratic processes. And with that, Josue, I'm going to turn it over to you for the virtual town hall meeting.
Yes, thank you, Brian. Please stay tuned. We're going to have a small transition to get the IT all ready. We're going to have our American Sign Language interpreter set up. So just bear with us for a couple of seconds, maybe a minute, and we'll have the virtual town hall right after this.
and we are live.
Welcome. Thank you for joining us for another virtual town hall. We appreciate having this opportunity to connect with you and provide you timely updates. And I want to thank my team for sticking with us through all of these virtual town halls. It's a lot of late evenings, but it is important, and it's important for us. It's important for you. So we will continue to have these virtual town halls. We're committed to providing you regular updates. So thank you for joining us again. As of today, we are now at 4,450 cases in Ohio, with 15 cases right here in Greene County. We're still at 1 death, and our thoughts are with the family in Cedarville, and we hope that our number remains low. As predicted by the model presented by Dr. Acton, these numbers will only increase from here. The model predicts that we would have around 10,000 cases per day. What we do matters now. It would have a tremendous impact down the road. So I ask our residents, encourage you, implore you to keep doing what you're doing to protect yourselves, your loved ones, your neighbors, and everyone around us. It is important that we take all the measures that we can. I know it's a sacrifice, it's a hard time, but we must hang in there. We must continue to do all that we can to help save lives down the roads. And we know that our actions have been disrupted to some residents and visitors, but I want to remind you that we are doing all that we can. We're being thoughtful, methodical with the actions that we're taking. Those actions include limiting the density in the community, limiting the parking, closing some of the playgrounds, putting hand sanitizer stations around downtown. All of this we're doing in an effort to help contain the spread of the virus, which will in turn help save lives. So thank you. Appreciate all your support and allowing us to continue to take these things, to hang in there while we do all these things. Joining us tonight is Melanie Kingsley from Greene County Public Health, also Colin Altman, Fire Chief, and Chief Brian Carlson. You might have heard from Brian House earlier today, and he's also joining us for the virtual town hall. So Melanie, I will pass it on to you. Thank you for joining us.
Thank you for having me. As you said, there are 15 positive cases in Greene County. We believe this is not the end of it. This is not our peak, but our peak so far was March 25th, and 14 days out from that would be April 10th. We'll reevaluate that as our peak on that date. Right now, there are 888 healthcare workers confirmed to have the virus across the state. There is coronavirus testing at the UD Arena parking lot. The new hours are 10 a.m. to 2 p.m. And this site will collect specimens from patients who have a physician's order. So that I just wanted to get that word out, because a lot of people think it's just drive up and get tested. To the amended stay-at-home order affected April 7th, runs through May 1st. We want to reiterate the public to avoid non-essential outings. I know the village is doing a great job keeping visitors out. I know it's really hard for everyone, but I think this is crucial to keeping the spread from continuing. The travelers returning to Ohio after spending time out of state are encouraged to do a 14-day quarantine. And that doesn't include people that cross the border of states for work, etc. So that may be enforced by state and local law enforcement. I had talked with Kate Hamilton about face masks for the general public. The CDC now recommends that we use a cloth face mask for general public in situations where social distancing is difficult. An example of that would be at the grocery store. I know Benzer Pharmacy has done a great job with keeping people out and meeting you at the door or doing deliveries. But if you are in public, it's important to have a face mask. we're going to be Kate and I are working on some recommendations for taking care of the cloth mask and how to keep it sanitized. The big thing about the cloth mask is it's not going to be extremely effective in the air that we breathe in, but it will prevent us from, if we sneeze or something, getting that out into the air. So it's not, it's technically not PPE, but for the general public, we want to use those. If you do have PPE such as N95 masks, cloth face masks, surgical masks, anything like that, if you do want to donate that, you can drop that off either at the health department at 360 Wilson Drive in Xenia, or we have, we have a drop-off point at Fairfield Mall. So we wanted just to get the word out on that. If you go to the ODH, the coronavirus.odh web on the ODH website, the coronavirus part of the ODH website, there is a checklist for the face mask covering. So you can see the proper way to wear it, whether or not you use a filter. They're recommending like a coffee filter as one way of using a filter that you can change out for one-time use. With cloth, the best way to clean it is using soap and water, because the virus is in a lipid layer and that's broken apart with soap. So soap is better than hand sanitizer, but we do recommend that if people are out to use hand sanitizer, making sure you have clean hands before you put your mask on. And once you take your mask off, it's basically contaminated, so you want to wash your hands again after use. So we'll get that. Kate and I are working on that, and we'll get that out to you for public distribution. Let's see. Just looking at all my notes here. So yeah, Fairfield Mall, we're also working to collect the PPE for transport, any PPE in the community or in the county, to get it to Battelle for decontamination. So we'll be doing that for Greene County. We're also working with Greene County Public Library, Spark Place, in order to, right now, we're just going to work on developing mask clips. And that may progress as we explore the technology. Basically, we wanted to reiterate points on flattening the curve. Treat everyone as they're positive. That's the big thing. With a face mask, it doesn't give you extra protection. And so we don't want people to get comfortable just because they have a face mask on. And we've seen that with glove usage. People with gloves will be a little reckless. So they have kind of this false sense of security. So we want to, reiterate social distancing, hand washing, coughing and sneezing etiquettes, monitoring of symptoms, and self-isolation if you are symptomatic, and reaching out to your healthcare professional. And I think that's all the new stuff that we have.
Thank you, Melanie.
Yeah.
And now we hear from Colin Altman.
Thank you, Josue. I'm coming to you live tonight. Miami Township Fire Chief Colin Altman coming to you live tonight from the White Drawing Room at Windsor Castle, where I've been spending some time with Her Majesty the Queen and Prince Philip. They're both doing very well, just in case you were wondering. First off, I just want to say good job to everyone. As Dr. Acton said today, all these horrific efforts that we're taking with the distancing and stay at home are working to flatten the curve here in Ohio. So that's exactly what we wanted. It's working. Not everyone is doing it, and you know who you are. I don't want to have to give license plate numbers, but I'll do it. So remember to stay home when you can. Excuse me. Something else I wanted to address tonight, I've seen it all over social media, and I heard people talking about it at Tom's today, is how many people in Yellow Springs and Miami Township have COVID-19. It is not a state secret. We don't always know who has it, who may not know, have it. I may know of some, but those pesky HIPAA laws keep us from telling you. And frankly, it doesn't matter. It doesn't matter at all because, like public health just said, we have to assume that everyone's infected. So if everyone's infected, do what you're supposed to. Wear your mask when you're outside. Cover your cough when you cough or sneeze. Maintain good social distancing and wash your hands. There are no current plans at the county, state, or federal level to go out and paint scarlet CVs on people's doors because, again, it doesn't really matter. From a healthcare standpoint, it's no one's business. Just like it's no one's business who may have coronary heart disease in your neighborhood or who may have HIV or who may be going through cancer. It's important that we support each other regardless and take the important steps that we have to keep each other and our families and our friends safe. As we like to say at the fire department, remember it's important. Be safe, be kind, be hopeful during this crisis. As always, we're here at the fire department to help you. I can say that we have gone out on some patients who think they have COVID-19. Our guys are out there every day doing their job. We're here to help. Call us at 911 if you think you need us, or just call us at our non-emergency number at 767-7842 just to talk, and we'll happily be doing that with you. And I'll close tonight with a quote from my dear friend, Her Majesty the Queen, and I never thought I would be quoting Queen Elizabeth, but here we go. Remember, this is a tough time, but we will be with our friends again. We will be with our families again, and we will meet again. That's all from Windsor Castle. Back to you, Josue.
Thank you, Colin. And we'll now hear from Police Chief Brian Carlson.
Thank you, Colin. Thank you, Josue. Good evening, everyone. The police department is pleased to report that we have received some handmade masks that officers will be donning very soon. We appreciate those. A special shout out to Miss Kate Hamilton. I think Josue's got one pulled up on his screen. And I know there's been some concern about officers and how we're responding to calls. It's in our traditional, very friendly fashion. We're simply there to try to assist and help in any way that we can. I think that it would be important for me to ask you at this point that we need your help as a community in the massive efforts that first responders, the medical community, firefighters, EMT, and peace officers are facing. And anything that you can do to keep yourself and your fellow humans safe, we greatly appreciate. We have received in the last few days a few calls of concerned residents about gatherings. All of those were resolved amicably, and we were happy about that. I will close in something that rings in my head over and over, and it's kind of been that way ever since I was a kid, and I realized my mom would tell me this, and I think that sometimes it's better to be kind than right. And if you see someone who's not meeting your expectations of what the governor's orders are or what keeps us safe amongst one another, then just distance yourself from that individual rather than speak out. I think that would be a good way to handle that moving forward. I appreciate it. Thanks, Josue. Back to you.
Hey, thanks, Chief Carlson. I really appreciate those final comments. And I also want to thank Chief Altman and Melody. Great updates about how we stay healthy. I see that we do have a couple questions that have come in. So Josue, I'm going to turn it over to you. I see that there's got online, and maybe we should talk about some of the chatting related to the turnaround on the tests.
Hey, Brian, were you queuing up the questions?
Sure. Yeah, I can. Well, let's have.
We have a list of questions already on
Yeah,
the SharePoint document?
we've got at least 3 so far. So Melody, can you just maybe respond to some of those questions about the turnaround on the tests?
So right now, any sample that's taken to ODH, and those are priority samples, it may be for someone that is in critical condition, and Greene County Public Health as well as I think we have a medical courier that's taking samples to ODH. Those have about a 24-hour turnaround time. There are labs in the area like Quest or LabCorp that are taking much, much longer. I know from personal experience. I'm negative, by the way, but it took 11 days for me to find that out. So, you know, knowing that there were people dying before they get their test results, Dr. Acton made a very good point to make sure you know where your tests are going. So there are local hospitals and medical facilities like doctor's office that have an in-house lab, and we recommend if you can get it there, do. If it is a priority population, like someone that's in critical care, or an older person, someone with a compromised immune system, make sure that they send the labs to ODH.
Thanks, Melody. So I think this next one is for the chiefs. And this was asking or referencing the fact that there have been reports of villagers with suspected cases of COVID-19. And asking whether our first responders can share how widespread they believe the illness may be in our community, and have you responded to calls for service for those exhibiting these symptoms?
Chief, do you want to start with that one?
Yeah, sure. It's really difficult to tell you how widespread it may be in the community, just based on what everyone's saying, what the medical professionals are saying. You know, probably out of the last 10 patients we've seen, maybe 8 think they have it. One of the big problems is it's allergy season, and a lot of the signs and symptoms that people are told to look for with COVID-19 mimic allergies and also mimic flu. So it's very difficult. Our guys are treating every single patient contact like they are possibly infected. So our guys are masked up on everything, safety glasses on everything, and it escalates from there depending on what the symptoms are. We don't really know, unfortunately, or fortunately, I guess. When we take someone in, we just have to treat them based on the symptoms, and then take them into the hospital, and the hospital takes it from there. If we have a positive that we've taken to the hospital, someone who tests positive, we are notified. We have not received any notifications at this point. So.
Thanks, Chief. Yeah, that's the critical point, folks, is if we receive information from the Public Health Department that there is a positive in our vicinity, we will definitely be getting that out there. Right now, we do not have any. I've received numerous calls. The police department has texts, voice messages about things that people are reading on social media. And rest assured, as soon as we know, you will know. Thank you.
All right, thanks, chiefs. And
Hey,
I have one other.
Brian,
yeah.
Can I just put out there real quick? I just want to remind everybody that, you know, we may get notification, we may say that there is a positive within Miami Township or Yellow Springs, but that's all people are getting. We legally cannot put out names, and that is ethically not correct anyway. We don't want to do that. And cannot put out addresses. So you may just get a number, which will probably just make people freak out even more. So, so you're not going to get a whole lot of information, unfortunately.
Okay. Thanks, Chief Altman. Melody, a couple more questions for you. Someone asks, how much should you wash the actual face mask before next use?
I spent some time researching the measures to get this sanitized. Just washing it on a hot setting is probably better, but washing it with soap in the washing machine, there's not a specific time that has been given, just that that soap is the best way. So basically, if you think about using something like Dawn dish soap, it may be irritating. I'm not sure what you want to use personally, but something like Dawn dish soap is going to break up that lipid kind of casing that, or the fat casing that the virus is in. So just like washing your hands, we want at least 20 seconds. So, just washing with soap, there's no specific time. The longer the better, but I would just throw it in a hot cycle in my washing machine.
Okay. And this one also for you, Melody. Should people still cover their coughs or sneezes when wearing a cloth mask because of the penetration, or does that cause other unforeseen problems?
Well, I think it wouldn't be comfortable, but extra barriers are ideal. So if you do have a mask on, you're going to have that one barrier. Putting up your arm would be another. With the face masks, unlike PPEs, there is room for particles or aerosol particles to leave the mask. So I recommend doing both if possible.
Okay, thank you. Another one for the chiefs. What measures are being taken in-house from calls to protect the first responders from COVID-19 spread?
From the fire rescue standpoint, it kind of starts with our dispatch center in Xenia. They screen every 911 call using an algorithm that's been developed to determine if there's any signs or symptoms that could indicate COVID-19. We just implemented the other day that on every patient call, even if it's little Jimmy trips and skins his knee, our guys gonna be wearing surgical masks and safety glasses as well as gloves. If it's suspected symptoms of COVID-19, someone's got a cough, they've had a fever, that type of stuff, they'll wear their N95 mask with safety glasses and gloves. And then if it is a positive that we're aware of, or someone identifies that, or it's someone who's unconscious, unresponsive, the guys will be in gowns, face shields, the whole 9 yards. So we also work with our guys. They screen their temperatures every day at the beginning and end of every shift. After a positive contact, with someone who might have it, they typically will also come back and launder their uniforms and shower just to decon fully. So we've got a lot of layers in place to protect our staff and to make sure that they can keep coming to work and serving the community, as well as they can go home at the end of their shift and know that they're not going to spread any virus.
All right, thanks, Chief Altman. Chief Carlson?
For the police department, primary was schedule adjustment. So we're trying to keep the same employees together on the same shifts. So if someone was to test positive, it wouldn't bring the whole department to a halt. So that's step one. We're staggering those as well. I do like to have 2 officers on at all times for various reasons. We're also, when you see officers now on any call for service, out of the vehicle, we'll be wearing either a face mask. We will have gloves, but if it's a medical call and we're assisting, we'll be in the N95 masks with goggles, gloves, and so forth. Officers are also taking precautions at home as well. Each officer does it a little differently. I know for myself, I'm changing in the garage, and before I say hello to everyone, I'm in the shower, and we're just kind of using those kind of protocols here for that. We're also limiting officers' time in the building here. So that's the things that we're doing.
Okay, thanks, Chief Carlson. I did want to mention the question to the tech team about moving the interpreter so that the red line is not right on top of her. We will or have addressed that. And Melody, we had a follow-up to the mask washing. asking whether heavily moisturized soaps reduce the effectiveness of breaking up the lipid layer.
I think any soap is going to break up that that viral casing or that lipid layer that we talked about. I don't think it makes a huge difference, honestly.
Okay, thank you. There was a question asking to go back and highlight the state of emergency discussion from the council meeting. So I will just briefly say that I think we all know that the state has declared a state of emergency. Governor DeWine has. Our discussion during the council meeting was whether there would be some benefit to doing that locally. And we learned from our village solicitor that we have in place the ability to respond to emergencies. So while that resolution or declaration may not be necessary, we're going to talk about it at our April 20th meeting and look at a sample resolution, because it may be something that just kind of checks off a box in terms of access to funding. But we don't have anything that establishes that that's true. So we'll talk about that more. But for the most part, the way we are responding now is supported by the Ohio Revised Code and our local ordinances. Okay. Do we have any other questions? I am not seeing any. Philip, you see anything else? Okay. So if not, Josue, do you want to wrap up today's town hall meeting?
Thank you, Brian. I believe we have a few other questions that came in previously. Melanie, this one may be for you. What do those that do not have a primary care physician or are uninsured, what's available to them?
Currently, what's available to those without insurance or are underinsured, we have Five Rivers Clinic. If you are showing symptoms, we don't recommend people coming into the clinic. If you're not familiar with Five Rivers, it is a federally funded medical practice, and it's located in the Department of Health. If you don't have Medicaid and you're uninsured and eligible for it, they have a sliding scale for those that are not insured, but they will help you get signed up for Medicaid. If you're showing symptoms, we recommend that you go to your local emergency department or urgent care. If you are showing symptoms, they want you to call first because before you can go in there, they need to be dressed and ready for you. Does that answer the question?
Yes, thank you, Melanie. And we have another question. I think you've answered this in your other comments, but you mentioned a testing facility. Is there any plan to have another testing facility that may be more accessible to folks here in Yellow Springs?
We do have a pandemic response plan in place. Right now, this is what we're doing. As the need increases, we'll just go from there, but nothing at this moment. As soon as that changes, we'll let you know.
Thank you, Melanie. And I want to remind folks of just how easy it is to wear these masks. I have two, one for Monday, Wednesday, Fridays, then the other one's Tuesday, Thursday, Saturdays, and I have another one for Sunday. But these are very useful. I know a lot of us here have them. They're locally made. So big shout out to the 20+ sewers in our communities that have dusted off those sewing machines and those skills and just gone to work and made these wonderful face masks. So they're really nice, really easy to wear. So thank you to our wonderful team of sewers that have gone to work and made these available to us. So thank you. And I want to close out to remind the residents that we're here as a resource. Reach out. There's so many ways that you can reach out. So please don't hesitate to contact us for any of your services. And I want to thank the strong team of community-based organizations that are working tirelessly to put in all the services that our residents need, from food, shelter, economic support. I feel blessed that we have such a talented pool of residents and such commitment from our residents to put together these resources. So thank you to all the folks that are participating and helping out. We couldn't do this without you. We couldn't be where we are without you. So thank you. And with that, I want to wish you a good night and see you next town hall on Wednesday. Good night.